speaker, and I came prepared with my Kleenex, but I'm hoping that I do just fine without it. Before I begin, I do want to thank Sloka, not only for what they've done for me, but for all my Teal sisters. And just as they've mentioned, when you're first diagnosed, it's a whirlwind, it's a shock, and you just, I can't even describe it, it's just overwhelming. But I remember when they brought in my sister box, I hadn't done very well with my first chemo, and but they bring it to you, and I'm looking through, and I remember seeing the survivor pin, and I'm like, why are they giving me this survivor pin? I just found out I had stage 4 ovarian cancer. But I have since discovered that you survive everything. You survive the surgery. You survive being told you have cancer. You survive every chemo, every surgery. You survive it all. And so I understood after a long time that that's why they give it to you, because they want you to know that they're there and you're going to survive all of it. So I will begin my remarks. I do want to point out I have 3 tables here of very good friends. Some have known me since I was a little girl, and others have known me as an adult. And all of these people have come all this way with me, but especially the last 3 years. And there's so many people here, or that aren't here, that have supported me. I'm just so blessed, I can't tell you. I'm just very blessed. Before I begin, there are 3 people I would like to personally acknowledge. I want my husband and my son, Nick, to stand up, please. They're going to be mad at me. This little thing. And then I'll be mentioning her in my remarks, but I would like my Dr. Andrea Hageman, to please stand. The reason I'm here tonight, the only reason I can imagine why I'm still here, is because of God, and because of Dr. Hageman, and because of everybody who supported me. So I know I'm very blessed. I'm often asked if I had symptoms prior to my diagnosis. Leading up to my illness, I honestly felt terrific and oblivious to the cancer that was growing in my body. At the end of April 2016, I was given a clean bill of health at my annual OB visit. At that time, I did not know I had so many risk factors for ovarian cancer, but my OB/GYN should have. It was all in the electronic, detailed history I filled out when I became her patient 2 years before. The lack of knowledge about ovarian cancer within the general medical practices continues to be a problem, especially in the smaller communities. The truth was, I did not know I had any of the risk factors, except that I had taken fertility drugs 20 years before, and at that time they mentioned I had a minute wrist. After I was diagnosed, I learned I had almost every risk factor. 2 immediate families with a history of breast cancer, endometriosis, having my first child late in life, only having 1 child, not breastfeeding, and never taking birth control pills. Following my diagnosis, I was genetically tested at Simon, and they discovered I had the biggest risk factor of all, the BRCA1 gene mutation. This mutation can increase the chance of ovarian cancer by up to 60% and breast cancer by up to 80%. I was a walking time bomb. Looking back, the only things I experienced that I later learned were symptoms of ovarian cancer were a urinary tract infection that seemed to resolve after antibiotics, and fatigue that I attributed to a very busy life. On June 7th, I experienced severe chest pain and shortness of breath. That was a symptom that got my attention. A local pulmonologist initially thought I had lung cancer after a CAT scan of my chest revealed fluid and nodules in my lungs. A month later, a PET scan was ordered for my chest, and this time included my abdomen. On Sunday, July 10th, I worked what ended up being my last time as a hospital pharmacist. The next day, instead of preparing chemotherapy, I became the cancer patient. My PET scan showed I was in real trouble, and I knew I needed a specialist. Dr. Andrea Hagerman at Zeitman accepted me as a patient. An extremely high cancer marker and an ultrasound confirmed I had ovarian cancer. The lung involvement established I was stage 4. I stared at my new doctor with paralyzing fear, and I said, I have 2 adopted children, and they're only 6 and 7 years old. She grabbed my hand and looked me in the eyes and said, we've got this. I can't promise to cure you, but I will get you better. As long as you're willing and we have options, I can keep you alive if you respond to the treatments. It has been almost 3 years, 3 abdominal surgeries, 1 prophylactic double mastectomy, 25 chemotherapy sessions, and 9 months on an oral PARP inhibitor to hopefully give me a longer remission. I lost my healthy body, my independence, my hair, my job, and what I thought was my identity. But I gained hope and learned to accept love and help and powerful prayers from friends and strangers. I have witnessed the absolute best in the human spirit. At different times during this cancer odyssey, I felt so bad, I thought I was going to die. A few times, it was so horrible, I wanted to die. But always, I was desperate to live. I longed to see my oldest son graduate from college, and my 2 little ones get old enough so they could remember me. Nick did graduate. Jaden and Alea are now 9 and 10 years old. I am so thankful for this time with my husband and children, and I feel selfish wishing for more time. Time many of my ovarian cancer sisters don't get. My cancer marker has been increasing a little each month, and I fear it's bringing me closer to yet another recurrence and a 3rd round of chemo. I get upset because I feel this did not have to happen. I needed to have a doctor that was educated in the risk factors and the signs and symptoms of ovarian cancer. By now, there should be an accurate screening tool so that the majority of patients are not late stage at diagnosis, but there isn't. The main reason I feel I should not be a stage 4 cancer patient is genetics. If I had been tested just 2 years earlier, when all my risk factors were so clearly documented, I could either have been diagnosed at an early stage or maybe not had cancer at all. 6 out of my 8 siblings in my family tested positive for the BRCA1 gene mutation. That testing yielded 3 breast cancers, 1 prostate cancer, and my ovarian cancer. Not really good odds. Half my nieces and nephews have the same mutation, including my biological son. Genetic testing will hopefully save all of them and their offspring from cancer. I want everyone, when it is indicated, to always receive genetic testing. While we are trying to find a cure for ovarian cancer, we should be preventing some with the one tool we have right now, and that's genetic testing. Everyone in this room are essential in the fight against ovarian cancer. It is not often that we can make a long-lasting impact in the future, but funding cancer research, supporting ovarian cancer patients, and educating doctors is a wonderful investment opportunity. SLOCA is a driving force that makes this happen each year. Cancer is exhausting. Cancer is depressing. Cancer steals your future. Cancer starts and ends my day and colors my life. It has changed my relationships for the better, allowed important things to take center stage, and prompted me to embrace every moment I have left. Cancer has changed me physically, emotionally, and spiritually. It has stolen many things, but it has also gifted me unexpected joys. I can't change my diagnosis or my prognosis. I can only try to stay healthy, raise awareness and money, and be grateful for my blessings. I thank you all for making this a very special night. I want to ask you for 2 more things. First, as we move into the final moments of the auction, if you are able, I encourage you to give a little more than you had planned. Second, over the next few weeks, I challenge you to talk about ovarian cancer. Just by starting a conversation, you can affect great change and save lives. As I continue onward, there will be difficult days. On those days, I will recall this spectacular vision of 360 souls gathered here tonight pursuing a common purpose: to cure ovarian cancer while educating and supporting. This will give me strength that you will never stop helping me and all of my Teal sisters. You represent hope, you exude caring, and we can't live without you. We most definitely can't live out loud unless you continue to stay with us. Thank you.